This presentation is about vaers, the Vaccine Adverse Event Reporting System. My name is Christina Baker, and this is for Biostat 6670 Public Health Informatics. Here's a quick outline of what I'm going to present to you today. We'll talk about the history and sponsors, what it is, what does it do, who are the target audiences, and very important for public health informatics, what are the technologies employed and how does it interact with other systems? Then I'd like to really show the importance of vaers, and I'll highlight example of a success. Alternatively, though, it's really important to think about its limitations. And then we can look at the current use and future plans of vaers. The development of vaers, where did the idea come from and who are the sponsors? vaers came out of the National Childhood Vaccine Injury Act of 1986. It was an outgrowth from that, which they required healthcare providers and immunization manufacturers to report adverse events from vaccines to the Department of Health and Human Services. So in response to this act, the CDC and the FDA as co-sponsors established vaers in 1990 as a venue for reporting these adverse events. So vaers, what is it and what does it do? It's a post-marketing or post-licensing safety surveillance program. So it collects information about adverse events or the possible side effects that occur after the administration of vaccines. They take this information, analyze it, and report the data. And this data is available to the public and the healthcare community. And it's really important to point out here, and vaers, they were very clear on their website about this, that it is mainly a vehicle for disseminating vaccine safety information. So they really wanted to be clear that they rarely provide definitive evidence of causal associations between the vaccines and the risks. So they kind of hope to be like an early detection system that can stimulate further clinical research. Now let's look at the technologies employed and how vaers interacts with other systems. On their website, they said they use a secure sockets layer. And so what they do is they take the confidential information that's supplied on these online reports, and there is some personal health information on there, and it is transmitted securely. SSL uses a public key to encrypt the data. I was able to talk to a manager at vaers, and they also told me about a couple other important kind of technologies and how they interact. One of them was MEDRA, which stands for the Medical Dictionary for Regulatory Activities. So MEDRA is an adverse event classification dictionary. It's used for coding. So vaers can take these narratives that are supplied electronically, and basically they code the data they receive to a standard set of MEDRA terms. And it allows them to exchange and then analyze the data. So, and MEDRA is used in the United States, but also other countries, in Japan and Europe, for example. Another thing I learned about was CDC Wonder. This is a really easy to use, kind of menu-driven system that makes the information that the CDC collects from vaers and other systems available to anyone, public health professionals or the public. It's a very powerful tool for being able to retrieve and analyze public health data. And then lastly, the CDC Vaccine Safety Data Link. They use information from vaers. They also use information from managed care organizations. That's more of an active surveillance system, but they link this information together, and it's a really great resource for public health. Now let's look at the target audience for vaers. First of all, we've got about 37% is the vaccine manufacturers, 36% is healthcare providers, another 10% would be from state immunization programs, 7% from vaccine recipients, or if it's a child, it might be their parent sending in the information, and then 10% is from other sources. Now, I really want to highlight the importance of vaers to public health and show an example of a success. VAERS has really proven, I think, its public health importance by providing health scientists with signals about possible adverse events following immunization. And I'm going to just quickly define signals, how it's used here. It's usually a concern that an adverse event could be temporarily occurring more often than you would anticipate based on chance. And so we're kind of showing that the event could be related to the receipt of the vaccine. An example of success of the VAERS program had to do with the RotaShield rotavirus vaccine. VAERS detected reports for intussusception over what you would expect by chance alone after RotaShield rotavirus vaccine was introduced in 1999. So they were able to take data from VAERS, and then that led to epidemiological studies that confirmed an increased risk. And then these data contributed to the product's removal from the U.S. market. So I think this is a very good and clear example of how VAERS proved their involvement actually in the prevention of disease. Now, of course, it's very important to look at some of the limitations, and a lot of this has to do with it being a passive surveillance system. That means that they rely on volunteer reporting of the illness following the vaccine. There's some requirement there, but also they just rely on data being supplied to them on this online report. So when you have the reporting, some of the problems could do with, for example, differential reporting. This means that the reporting could be increased maybe after the first few years after a vaccine is licensed, or you could have increased reporting of events right after a vaccine, but maybe a couple of weeks later they wouldn't report that or associate it. Stimulating reporting means that the reporting is increased after a known or alleged type of adverse event. So maybe people would see or hear about adverse events in the media and be more likely to report it. Coincidental reporting, there could be an illness after a vaccine, but it really has nothing to do with the vaccine. It's just coincidental. And then, of course, underreporting, that's a very common thing that you might see in a passive surveillance system. And then lastly, a real limitation is the data quality. VAERS does not collect any kind of denominator data. So that basically means that they don't collect data on the number of doses of a vaccine that were administered, and so you really can't calculate any actual rates of adverse events, and there's really no control group, so that limits their data. Now I'd like to look at currently the main use of VAERS. So the objective of VAERS is to detect maybe new, unusual, or rare adverse events. VAERS can monitor increases in known adverse events. They kind of like put up a red flag and they keep a watch on that vaccine. Third, they can identify potential patient risk factors for particular types of adverse events. And another objective is to identify vaccine lots with increased numbers or types of adverse events. And then, of course, they report this to the manufacturers and the public health community. And then lastly, VAERS is really important in assessing the safety of newly licensed vaccines. Now let's talk about future plans for VAERS. I'm going to link this up with something that was called the Strategic National Vaccine Plan of 1994. And the purpose of this plan was to promote achievement of a national vaccine program. They would provide strategic direction and kind of promote coordinated action of the entities involved with vaccines. So since 2008, they've been redrafting this plan, and it actually should be completed by the middle of this year in 2011. So in this plan, they have a goal for VAERS, and VAERS is a big part of this plan. One of them was to increase medical histories and biological specimens in their reporting. And another was to really improve the assessment of the adverse event from immunization, those signals that we talked about. So, and lastly, I would like to say I have a challenge for VAERS. How could they include denominator data to give their data a little bit better quality. Maybe they could link up a little bit better with another system that has that denominator data. And I think that would really increase the importance and the use of their data. So I hope you enjoyed this presentation. Here's some of the references. I hope you can kind of scroll through some of these. They're really useful, have a lot of information. Like I said, the CDC Wonder was really an interesting site. Can give you a lot of immunization information on that. So I hope you enjoyed this. Thank you.